proposed budget for kinship care right now is $584,000, but those funds do not go directly to grandparents raising grandchildren.
Channel 2's Public Affairs Director Jocelyn Dorsey talked one-on-one with the head of the Georgia Budget and Policy Institute, who takes a deep dive into the state budget to let us know just where our tax dollars are being spent.
Linda, Taifa Butler is the new executive director of WSB-TV, as it is called, a nonprofit, nonpartisan agency. I first asked her to explain the mission of the organization.
We want economic opportunity for all Georgians, and that's what we were founded on in 2004, was really how can we make Georgia be this prosperous state where everyone, no matter where you live, no matter what income you have opportunity to do well. And our organization focuses on education and health care as the primary pillars of economic opportunity, but also the budget, which is, to us, one of the #1 pieces of legislation that passes each year, which is the only legislation that has to pass each year, but it affects the lives of every Georgian.
There's been discussion about the minimum wage in Georgia. Kind of where are we in that discussion?
We had written a piece last year to show that if Georgia did increase the minimum wage just to $10.10, we could give a raise to 1 million families in the state. There are many families, again, as jobs have grown since the recession, we're seeing a lot of those jobs that are coming back to Georgia are very low-wage jobs. And those are the jobs that families are having a very hard time making ends meet. There's been a number of studies done where people think it would be a detriment to business, and we don't see that happening. I think as more people make more money, that creates more in our economy for businesses to be supported, more customers to serve businesses. So I think overall it would spark the economy in a way that would be very advantageous for the state as opposed to a detriment.
I do want to ask you about, and I always get it twisted, Medicaid, Medicare. There's been a lot of discussion about the fact that the governor has not accepted funds, and that has affected hundreds of thousands of Georgians. Where are we with that?
We have advocated for years now for Georgia to expand Medicaid. We're encouraged that the conversation is now being had more with the Georgia State Chamber and the Georgia Hospital Association, and that there's a commitment that we understand behind the scenes right now to think about what a plan could be for Georgia. And there's been many advocates, as you know, and even Representative Abrams dropped a bill to expand Medicaid, I believe just last week. So people have made the moral case that it's the right thing to do. We have more than 300,000 people who fall into the coverage gap. They don't make enough to even be eligible for Medicaid. And so you're talking about veterans, working adults without children. These are the folks who don't have access to see a doctor when they're sick. How do we talk about Georgia being the #1 place to do business when it's not the #1 place to live? We've made the economic case. The $2 billion over the next 10 years, we believe that we have the funds with the insurance premium tax and the other state income that we can make the investment necessary to expand Medicaid so that these families can be better.
The Georgia Budget and Policy Institute has also taken a position on child welfare in general in our state, and I'll have that part of her interview next week.